first over, this would be outside the room. I'd make sure that I have the orders and the cross match for the blood. And then I would also make sure that there has been informed consent signed, and that's what I would do before I walk into the room. And I walk in. Hi, Mr. Hassan, my name is Bella. I'm going to be your nurse today. Can I check your name and date of birth? Okay, perfect. I'm going to provide privacy, shut the door. I'm going to do hand hygiene and get gloves. Okay. I see that you're in here for anemia resulting from a GI bleed. We're going to be giving you some red blood cells for that, just to help your body overall. And this is informed consent. As we do this transfusion, I'm just going to ask you to look for any signs. If you're not feeling well, if you start to get a rash, have some chills, shortness of breath, anything along those lines, then just let us know and we can help you out with that. I'm going to assess your vital signs first, just so that we get to have a good baseline. I would do his blood pressure, I would do temperature, I would do his oxygen, I would do everything. Everything is within the range, so we can continue. I would then assess his lungs and his heart. I would auscultate them both. I would do the front and back lungs, and I'm going to just make sure there's enough fluid so that we don't overload him. Can you take some deep breaths? Good. Good. Okay, I'm going to have you lean forward for me. I'm going to just listen to the back of your lungs. Deep breaths. Good. Perfect. I'm just going to listen to your heart right now. Okay, his heart rate and rhythm sound good, and I don't hear any fluid in his lungs. I'm also going to check for signs of fluid overload, including jugular vein distension. He looks all right. I'm going to check and make sure he has no edema. I'm going to check his pedal pulses and make sure that I can feel them and I can feel them. I'm going to check his IV site. Just make sure everything looks good. There's no redness, swelling, signs of infiltration, or anything like that. Yeah, I'm gonna just check everything. I'm gonna go get your blood now. I'll be back. Okay. I'm gonna go to the blood bank. I'd have a nurse here with me. I'm gonna do it with Sarah, who's filming me. But I would look at this tag and I'd be comparing it to the other orders. Okay, so I would have them repeat back what I'm saying. My patient I'm getting blood for is Darius Hassan.
Darius Hassan.
His birthday is 08/10 of 1985.
08/10, 1985.
His account number is 982541367.
982541367.
He is A positive and he's receiving O negative.
A positive, getting O negative.
And then I'm gonna also double check my informed consent with my nurse.
Perfect.
Okay. All right. As I go back, I'm just gonna make sure that there's no cloudiness or anything strange about this blood with the color. It looks great. I'm taking this back to my patient. All right. I'm back with your blood. I'm going to provide privacy again, and then I'm going to just do hand hygiene again and put on some more gloves. I'm going to make sure that I start this infusion within 30 minutes of receiving this blood. And then I'm going to want to have the infusion completed by the time 4 hours is up. Alright, I'm going to get my tubing. I'm going to open this up. And then I'm going to get my saline bag. I'm going to take this medication. This is all in the same room now. Alright. We're just going to get you all hooked up here. Take all these off. Take a look at my tubing, the white tubing. I'm going to make sure that I have all my clamps clamped up. So that we're not going to have blood leaking all over the place. Okay, we should be good. I'm going to take this and I'm going to spike one of these into my saline. Alright. This over here. Hang it up. So, and then I'm going to just bring this trash can over here so I can prime the tubing. I'm going to unclamp this. I'm going to want to get saline above the filter in here. Okay, that should be pretty good. And then I'm just going to undo this clamp right here so we can prime this tubing. There's the cap on this. Okay, there's our bubbles, so I'm just going to clamp this back off. Perfect. Now, I'm gonna get my blood. I'm gonna make sure I close this so that blood doesn't backflow up into my saline. I'm gonna take my blood. Double check all my clamps are clamped. Okay. I'm going to take this and I'm going to spike my bag of blood. Okay. I'm going to hang this on up here. And then I'm going to hook them all up to this tubing. I need to grab me an alcohol swab so I can scrub the hub and flush his line first. I want to scrub for at least 30 seconds. Just to make sure it's nice and clean. I'm going to take my saline. Okay. I'm going to take this. I'm going to flush a couple milliliters. Just make sure the tube is patent. Okay, Perfect. Then I'm just going to take this. I'm going to scrub one more time. I'm going to hook them up to my tubing. Again, just make sure that you tell me if you have any symptoms of an adverse reaction to this blood. I'm just going to get it started here for you. I'll open my clamps. Okay. This would be running, I'd be running it at 2 milliliters per minute. And after 15 minutes, I would be reassessing his vital signs. I would come in and just make sure that he's not being overloaded by fluids. I'd be comparing them to his baseline. I'd ask him if he has any adverse reactions, and I'd be observing him for any signs of any reactions to the drug or the blood. And if he was having a reaction, I would make sure I stopped the infusion immediately. I would hook up a different tube with normal saline, and I'd start running it to flush out the blood as fast as we can. I notify the provider, and then I take all of this tubing and the blood to the blood bank or the lab just to get it tested to see if there's any underlying causes of the reaction. I would also have given him his medication 30 minutes prior to starting the infusion, because I forgot to say that. But yeah, if he is not having any adverse reactions after 15 minutes, I could up the rate a bit. And then after the infusion is completed, I would open this up and close this so that I can just flush the line with normal saline to make sure we get all the blood into his body. And then I would unhook him. That's clamped. And then I make sure I flush his IV again. Another alcohol wipe though, but I'd flush his IV again. And then I would get a baseline vitals for after, and I would compare him to his previous vitals. I would continue to monitor him throughout the next little while, and I'd remind him about delayed adverse reactions to the blood, and I'd be watching for those as well. I would make sure I document everything on my pink sheet that I got from the blood bank, and I would make sure that he doesn't have any signs of fluid overload. Reassessing vitals, fluid overload. I just listen to his heart and lungs one more time to make sure everything's all good. I just educate him. Make sure he doesn't have any questions about it. Deep breaths. Putting forward for me. I don't hear any crackles or in any lobes of the lungs, so he should be all right. All right, I'm not straight from baseline, so I just document everything that happened and continue to monitor him.